years. So we came with the fractional concept, and while talking about the hybrid system, this is the new generation. In one sentence, I'm sure if you do know CO2 laser, you know that we can play with the energy, we can play with the density, and in some devices we can play with the pulse duration. Mostly if it's super pulse, this is a certain pulse duration. If it's ultra pulse, this is another pulse duration. Here we are talking about playing not just with these parameters. So it's not just the power, it's not just the on time and the density. We can actually control the ratio of ablation and non-ablation, and within those two we can control the ratio of ablation, coagulation, and this again maximize the possibilities of our treatments. Let's talk about the second component. So the second component is a non-ablative fractional laser. And I'm sure you're all again familiar with the different non-ablative fractional laser in the market. Again, 1540, 1550, 1565. This is 1570. It is used in general and plastic surgery and in many areas of aesthetic and cosmetic dermatology. But again, mainly it is used for the treatment of acne scars or different scars, skin rejuvenation, stretch mark, and melasma. I do have to say that I do not use it for melasma. In general, I don't use energy-based devices for melasma, but this is one of the approved indications. One of the advantage that it offers short downtime, very sparse adverse effect, but again, the efficacy is lower, inferior as compared to CO2. Talking about the third component, this is sonophoresis. For the people who are less familiar with the impact, we're talking about acoustic pressure ultrasound technology. So this device creates a pull and push effect, and it just pushes, it aids the transepidermal delivery of different cosmeceutical. It facilitates the diffusion and permeability. So generally speaking, we push different cosmeceuticals, different drugs into the skin. And if you again look at the literature, this is just a partial list, there are much evidence in supporting the use of sonophoresis for different dermatological and cosmetic indication. However, why combining? So I'm sure you're all familiar with this phrase: if you have two good technologies, so two good things in life, we used to say that one is one as synergistic effect and it equals three. But in this case, this is 1 + 1 + 1. This is three supreme technologies. And with these three technologies, this combination, the sky is the limit. And I will show you in a second why the sky is the limit. I'll start why it is important to combine between modalities. This is, I think, one of the most important publications that came out last year. This is a summary of 3-year work, and you can see it is signed by the very well-known scar experts worldwide. I was privileged to be part of this publication. I will not get into details, but generally speaking, this publication, for the first time, it put in writing the sentence that lasers are the first line treatment for traumatic scars and contractures. And if you have patients and those patients do not have access to this treatment, they actually get an inferior treatment. It is important, and this is if we talk about the insurance companies and again the multi-disciplines that treat scars. In this publication, we were trying to assess which modalities should be used for which scars, and we came to those conclusions. One, if you want to maximize your result, you have to actually combine between different multiple laser types. Combination will provide you with better aesthetic outcome in the end. But it's not enough. You have to combine between lasers and medical therapy. Again, different medications, and I will elaborate on it in a few slides, but different medications, different cosmeceuticals. You can use the laser-assisted drug delivery, so just creating channels by the lasers applying the cosmeceuticals or drugs, and then those drugs, these cosmeceuticals will get into the channels and will just dissipate into the skin. But you can use what we call the enhanced laser-assisted drug delivery using the sonophoresis. So for the treatment of scar, this is for sure. If you want to maximize your result and you have ablative and non-ablative lasers along with sonophoresis, you can achieve better outcomes. Talking about skin rejuvenation, actually, same journal, different publication or different publications. And you can see that generally speaking, we do know that if you want to maximize your result, and we talk about the improvement of skin quality, so facial rejuvenation, you should use different laser modalities. Some people already use, for example, IPL. This is of course not a laser, but IPL followed by another laser. But the combination of ablative and non-ablative lasers together with transdermal delivery of different cosmeceutical will maximize your aesthetic result. So this is the reason the device was, the system was developed, and you have this combination of three technologies. We talked about the CO2, we talked about the non-ablative 1570 and the sonophoresis. Now, I will not have the time to cover all the indications and all applicators because you have numerous, allowing from fully non-ablative to ablative, from bulk heating to, again, ablative. All possibilities are okay and welcome. I will focus on one very unique handpiece. We call it the Pro Skin Handpiece. And you can see, let's start with the very large scanning area. So it allows a relatively short treatment. This cooling tip, you can see the ring, it's very, very cold. So it's more convenient for the patient and for the physician. And apart from the ergonomic design, this handpiece can emit both wavelengths in all combination. So you can decide and emit just 1517 nanometer laser. So every pixel will be 1570. And again, if you look at the histology, you have different setting. With the low setting, you can see the epidermis is untouched, but you can see very nice zone of coagulation. And if you change the parameter, then you make the change deeper and more and wider. Again, you can see the change, and we have many biopsies to support the changes seen with the change of different parameters, but you can go deeper, as deep as 1,200 micron, and you can go, and we talk about the width. So the width, the maximal width is approximately 400 micron. From this Pro Skin handpiece, you can decide to be fully, I would say, it's not fully, it's fully fractional ablative. So every pixel is 10,600. If you look at the histology, and again, different settings, different parameters, you have the mild, the moderate, and the high setting. You can get very deep. One advantage as compared to other CO2s in the market, that you can play with the on time. So if you go with very high power and relatively short on time, let's say 55 or even 60 watts, and you decrease the on time to 0.4, you will go very deep. We're talking about up to 4,000 micron. If you increase the on time and you decrease the power, then you increase the thermal effect. Again, you will get less dip, but you will have more zone of coagulation. You will see in a second many tissue laser interactions are possible. But this is not unique. I'm sure you're all familiar with different non-ablative fractional lasers. You're all familiar with different CO2 devices and systems in the market. Let's talk about the combination. First combination, you can decide to have a pixel first with CO2, followed immediately by a wave of 1570. So every pixel is CO2 followed by 1570. Then you have different tissue injury. Please have a look. This is CO2 alone, again, relatively mild setting. This is just the 1570, again, different settings. And you can see that while combining first CO2 immediately followed by 1570, you have a very unique tissue injury, an injury that wasn't present in the market before. So this is one advantage, and it is used for different indications. But actually, this is not the main innovation. The main innovation is this one. There is no system in the market in which you can decide for yourself which pixel will be ablative and which pixel will be non-ablative, and the ratio of ablation and non-ablation. For example, here, we decided that every pixel or every second pixel will be ablative. So this is a 1-to-1 ratio. 50% of the pixels will be CO2 and 50% of the pixel will be 1570. I'm sure you haven't seen such a histological picture before. You have a crater, zone of ablation, surrounded by zone of coagulation, and just adjacent to this pattern, you have untouched epidermis with zone of coagulation. And this is unique, and you will see in a second why it's very unique. You can decide to change the ratio. You can decide to be less aggressive and to be more non-ablative. So here, 2/3 of the pixels will be 1570 and only third will be CO2. Again, you can decide to be more aggressive. So 2/3 of the beams, 2/3 of the pixels will be CO2 and only third will be non-ablative fractional laser. By this different tissue interaction, first, you can treat different indications. Second, you can actually promise a certain downtime. If you go more aggressive, you will have longer downtime. If you go less aggressive, you have short downtime. And again, I'm sure you all familiar with different patients. So different patients want different downtimes. Some patients cannot actually stay at home for more than 3 days, and this is possible. And again, we're talking about a CO2. While switching on the device, you're able to get into 5 modes. So first, and I will in a minute get into details, we're going to talk about the hybrid lift, the high-grid new technology. You can decide on different ratio. I told you 1-on-1, 1-on-2, 1-on-3, and again in favor of non-ablative or ablative. You can decide to be fully non-ablative. This is the soft lift. This is just by the press of a button. And again, this is only 1570. So every pixel will be 1570. There is the very unique Oscar. So you will see it in a second, you have different predetermined settings for different scars. everything is possible, either having CO2 immediately followed by 1570 or the hybrid or different possibilities. You can go with the just CO2, the known CO2 with all possibilities. It's very diverse, from painting, what we call here brush technique, to all patterns possible, from fractional to dot to line to fully ablative. And there is one button and one mode which is called freehand, with which you can do whatever you want, but be very careful. This is a strong device. So we have the predetermined setting. After you have the experience, you can start and play with your device to customize it to your needs. So this is two, and we're going to focus in this webinar on two possibilities. One, this unique hybrid technologies, what we call hybrid lift. You use two lasers in different ratio. This is how it looks. Let's see if it works, the movie. Okay, this is how it looks, and this is a ratio of 1:1. You can see this is the ring, the large scanning area. It's very cold, so relatively it's non-painful, and you can see the end of the treatment. And in the end of this two laser treatment, you can use the impact for sonophoresis. Because of the possibility of changing your settings, changing the ablation and non-ablation ratio, changing the ablation and coagulation ratio of the different lasers, you can actually treat difficult or more difficult to treat areas. And I'm talking about the décolleté, and I'm talking about the neck, and I'm talking about the dorsum of the hands. But I have to say that I've treated the knees and other areas in the body. The second important modes, and before we get into your clinical cases, this is the Oscar. Again, while pressing the button, while getting into this mode of Oscar, you have this screen which is opened, and you can choose which scar you treat. And then you will have our recommendation of the different ratio between ablation and non-ablation, so 1570 and CO2, and the different settings, and you will see the rationale behind every choice in a second. How it looks, this is, for example, an hypopigmented atrophic scar. This is the treatment with the hybrid Oscar system, followed by the application of pimatopost. And this is the treatment of keloids, or what was left from a keloid after a few sessions of cryotherapy and injection of 5-FU and triamcinolone. And this is again different setting with the application of triamcinolone, 5-FU and hyalase, and again the use of sonophoresis in order to push the material into the skin. So before getting into my cases, I want actually to deal with your cases. So before the webinar, we asked the distributors and we asked the audience to send our cases. So we got numerous cases, out of which I chose 5 cases, and one case is actually mine, but this is a patient, this is an international patient that was sent to me by a Turkish plastic surgeon, and I'm not sure he's here, but I'm sure that many people will listen to this webinar, so I'm sure he's gonna be very glad to see the procedure and the result. But let's start with your patient. So I'm sure you all have such patients. This is the first patient. This is a 70-year-old female patient who came to the clinic. She doesn't want to go through a surgical procedure, which actually she can benefit from. She doesn't want to be injected. She wants her skin to be improved, and she doesn't care. The longevity of downtime is not an issue. So while asking her if it's possible to go aggressive, she can allow it. And if she can allow it, you can go more aggressive. So try to think before I'm giving the answer. What would you do with such a patient? I'm sure you can agree that if you want to dramatically improve skin quality, you have to go more aggressive. You can use a phenol pill. This is one possibility. It's a good possibility for such a patient with such a skin type. You can go with the CO2, okay? Fractional ablative CO2, different devices. But I'll show you what we do with the hybrid system, and we're talking about the hybrid mode. So one treatment will provide this patient with very dramatic result. If you want to maximize your result, this is 1 to 3 treatment, and the ratio of this treatment will be 1 to 1. So 15% of the pixels will be 1570, and 50% of the pixel will be CO2. You can see the density and the setting. You can see the elongation of the on time in order to induce more thermal effect. So you have relatively long time for the ablative and for the non-ablative lasers. With the addition of sonophoresis, we usually drive vitamin C and hyaluronic acid into the skin. And the periorbital region, of course, if you want to treat this region, you have to insert intraocular metallic shields. And then we go a little bit less aggressive. You can see the change of the ratio. You can see the change of density, of course, the density of setting. With such a single treatment, you will have a dramatic improvement of skin quality. If you want to maximize your skin quality, you will have to have 3 treatments. Now, I'm sure you will ask me, so I can achieve very good results with my old CO2. This is, of course, true. However, and I have more than 10 years of experience with other CO2 in the market, with the more aggressive CO2 in the market, a very good result. However, the downtime, the erythema, something is a little bit longer as compared to this device, which allows what we call an ablative treatment, but with easier downtime and again, good results. So this was our first patient. Let's talk about another case that that was sent to us. This is, I think, a Brazilian case, and I'm sure you all encounter such patients with stretch marks. This is a 42-year-old female, and she wants her stretch mark to be improved. I do have to say that talking about stretch marks, there is no one solution because you can only improve stretch marks. This is a very difficult to treat indication. And if you look at the literature, you have many modalities which can be used. I'm sure you all try to think what you would have done if it was your patient. And I'm sure you can come out with any modalities in the market. So non-ablative modalities like radiofrequency, non-ablative modalities like 1550, 1540, 1565. Of course, you can treat with our 1570. You can go and treat this patient with ultrasound. There are publication by Casanova from Brazil. Combination of HIFU and some biostimulation. I think she used calcium hydroxylapatite. So again, the list is very long and there is no right and wrong. What we encounter with the hybrid system, and I'm talking about the hybrid mode, that we see quite dramatic effects. If you use, and again, if you go to the mode of Oscar and you change the ratio, so you change the setting to stretch marks, then you have CO2 and 1570. You have a ratio of 1 to 3 in favor of non-ablative fractional laser. You can see the density and you can see the setting together with the application and sonophoresis of vitamin C and hyaluronic acid, and you have very dramatic results. I do have to say that I tried in my clinic all modalities. I have 47 devices in my clinic. So I tried for stretch marks, everything. And I do have to say that nowadays, our protocol is one treatment of the hybrid system. You can see our setting, and one treatment of just microneedling with no laser. For some reason, we have very good results with this combination, but you can see the settings of our hybrid system. Let's go to our third patient. This is, I think, a case from one of the, I think it's a Russian patient, and this is a 42-year-old female patient. You can see she was treated with isotretinoin. She finished her treatment, the course of treatment, 7 months before she was referred. She was referred to the doctor, and again, this is the pictures that I got. And she wanted her acne scars to be improved. Again, talking about acne scars, this is a broad topic, and I think if maybe we will do just a webinar on the treatment of acne scars. But if you treat acne scars, there are 4, I would say, rules that I'm telling my patients. 1, acne scars cannot be eliminated. If you're talking about the percentage of improvement, I would say around 60%, not more. Again, this is the average. You have less, you have a little bit more, but of course you cannot achieve. And I have some doctors whom I see their patient, and their patient claim that their scars, acne scars, were promised to be eliminated. Again, you cannot eliminate acne scars. You can just improve acne scars. This is one rule, and it has to be said in advance. The second rule, that there is no magic wand. I would say there is no magic laser. It's always numerous treatment. In the past, I used to do one aggressive CO2 laser treatment or phenol peel, but I think, again, though it was improved dramatically, you should have several treatment. And nowadays, I offer my patient always that they will need to go through several treatments. So 1, you cannot eliminate. 2nd, there is no magic. There is no magic device. It's always combination of devices, and it's always, I would say, numerous treatment. And the 4th rule, that if you want to maximize your treatment, you have to combine between physical modalities. These physical modalities can be surgical and non-surgical. For example, if we talk about the surgical, it's subcision or cross TCA or punch procedures. It can be non-surgical, for example, microneedling, but not only. You have to use some biostimulation. So I inject either Sculptra, or I inject, again, no financial interest, or some calcium hydroxyl apatite, but you can inject some AJ-based material as well. And of course, the combining or the combination of some devices, some energy-based devices. We have very good experience with the treatment of the hybrid system, and I do have to say that we have a better outcome as compared to the regular CO2. our protocol, and again, this is not my patient, so I'm just showing what I would have done if it was my patient, but I would go for two different direction. So one modality, okay, or one visit would be dual, what we call dual plane injection. We publish on this matter, so we subsize the tissue, the area, the scarred area, and we use, this is in the layer of the hypodermis, and we use the inverted pyramid injection that was described by Goodman, and we inject either deep and more superficially. We inject biostimulatory agent. I really like to use calcium hydroxylapetate. We published on this combination in the clinical and experimental dermatology a few years ago. So this is one visit, and again, 4 to 6 weeks after this visit, we use the OSCAR, we use the hybrid system. You can see the ratio. This is 1 to 2 ratio. Density is 5. You can see the setting, and at home we prescribe azelaic acid 20% twice daily, and sunscreen. And with this combination, so we have 6 visits in general, one dual plane injection, and again 4 to 6 weeks afterwards we have the hybrid system, so three double session, I would call it. We have very good results. Let's talk about surgical scar. This is a case that was sent by one of our neighboring countries. This is a 45-year-old female patient, and she went through the excision of excess skin. And you can see usually those operations are more prone for scarring. So you have hypertrophic scar. If you want to know how many months post surgery, so we didn't have this details, but as far as I can tell, I think we're talking about few months post surgery. But again, if someone has different answer, so please write us in the chat box. So we have a hypertrophic linear scar. So again, to treat scar, and I will not get into details, we can have a full webinar on the treatment of scar. You have to combine between lasers, you have usually to combine between vascular lasers, and you have to combine between fractional ablative and non-ablative laser together with the injection or the use of laser-assisted drug delivery. And I'm talking about different anti-inflammatory and anti-fibrotic agents in this case. And again, we have several cases that we tried in the last 2 years with dramatic result. We talk about the a ratio of 1 to 2 in the favor of 1570. You can see the density, you can see the on time, which was reduced. So we want deep and narrow CO2 pixels, and we want some 1570 effect together with a topical application of triamcinolone 5-FU and hyalase. It helps the diffusion of the triamcinolone 5-FU into the skin. At home, we use different tapes. I'm sure you're all familiar with different silicone-based tapes in order to improve, and we have very good result. Before the last case, so this is another 48 female patient, and this case was sent to us again, and I took it to this direction. This is a relatively young patient. You can see the beginning of deterioration of skin quality, epidermal and dermal. I'm sure you can offer different modalities. So here, if you do just an IPL, it will improve skin quality, or different superficial peel. But if you want to do laser, and I think we have, and you will see in a second, our result with a patient that is similar to this patient, we're talking about 1 to 3 treatment, and we talk about relatively short downtime. The density, this is a mistake. So we talk about a density of 3 or 4. You can see the ratio. The ratio is 1 to 3 or 1 to 2, and you can see the setting. You usually apply vitamin C and hyaluronic acid, and on top of it, we discharge our patient with tretinoin 5%. This is only one application, and it accentuates our result. And so this is our recipe if you want good result and if you want relatively short downtime. The last case is actually my case, and I'll show you the results in a second, but this case was sent to me by a Turkish plastic surgeon, and this is the reason I'm showing the case. So this is a widespread, this is a burn scar. By the way, it's not just the hand, so as it's the upper trunk and the face, but I'll show you because this patient didn't want to be exposed. So I'll just show you the hand, the upper left limb. So please have a look. If you get closely, you have an hypertrophic, widespread hypertrophic burn scar. This is on the shoulder. And if you go more distally, you can see you have a widespread hypertrophic scar. It's a thick scar. And here, how would you treat your patient? One of the questions that was sent to me was, this is a new device that came into the market. And I think the question was sent by a Spanish physician. I don't know the specialty, but it's a good question. And this physician asked us, and it seems that he's very experienced. I'm so familiar with aggressive CO2 laser treatment. I'm sure I could achieve very good results with my previous CO2. I'm sure you can. And until I was introduced with this device, I used different CO2 laser devices and I had good results. However, and again, this is just an initial sentence. We know what we know. We might know what we do not know, but we do not know what we do not know. And I do have to say that this is the very beginning, but we do think that if we combine between non-ablative and ablative lasers in the same treatment, we have better improvement of skin quality, switching a scarred area into a more normal skin. Why? I do not have the answer yet, but I can tell you that we investigate it. Maybe this is one of my friend, Dr. Pasch from Germany, and he showed, we had a webinar that you can watch. It was an IMCAS webinar, and I wasn't familiar with this fact, and he showed and said that if you use non-ablative laser, you have more elastic fibers, new elastic fibers, which are produced as compared to collagen fibers. And if you have ablative fractional lasers, you have more collagen fibers, which are produced as compared to elastic fibers. And maybe, because if we talk about the skin, we talk about collagen, so we talk about the dermis, we have cells, and we have extracellular matrix, we have collagen fibers, we have elastic fibers, we have many glycosaminoglycans. So if you want to really take a scarred tissue and divert it into a more normal tissue, then I think maybe the combination of ablative and non-ablative laser at the same treatment will provide you with better outcome. I can tell you that my patients, the one that we switched from only old strong CO2 to the hybrid system, they claim that the results are better. Again, days will come and more studies will show in order to prove our, I would say, statements. But from the 2 years of experience that I have with this device, nowadays with such scars, this is the modality that I choose, and I choose it over the old CO2. So what are the parameters? I'm telling you the parameters in general, because in a second I'll show you the treatment of this patient. So 4 to 8 treatments. Again, this is just a sentence. So no one can say 4 to 8 treatments on a burn scars. So the decision to stop treatment is based on a dialogue between the physician and the patient. And when we think it's good enough, but generally speaking, if I look at all my burn scar patient, it's usually between 4 to 8 patients. You can see the settings, the recommended setting. Again, the mode is OSCAR. We're talking about CO2 and 1570. You can see the ratio. And again, CO2, the parameters, the 1570, impact of triamcinolone, 5-FU and ILAs. And I'll show you in a second that after flattening the scar, we actually get to more, I would say, bioactive peptides and hyaluronic acid in order to improve skin quality. You will see it in a second. And at home, we use silicone-based product. So what is the take-home message? And with that, I will finish and I'll share my cases and our experience. So I'm sure you all meet many patients on a daily basis. Different patients have different needs, different expectations. They're willing to go through different procedures with different downtimes. If you want to allow yourself to have, I would say, different possibilities, different indications, if you want to be possible to promise different downtimes, you have to have a device which which allows you different desired laser tissue interaction. And this is the reason the Alma Hybrid was developed. Again, we talked about the history of CO2 laser, and I'm sure this is one of the most important laser in the market if you treat, and it doesn't matter if you're a plastic surgeon or if you're a dermatologist, but this is an important laser to have. I hope I convinced you that we talk about a new generation laser, a new CO2 laser, which I can't even call it a new CO2 laser. It has a different entity. This is the new Alma Hybrid system. It combines these 3 technologies, and with the different applicators, it is fully versatile. So you can go from fully ablative to fully non-ablative. You can go from fully fractional to non-fractional. You can be focused, defocus. You can use the scanner or use the painting. Here we call it brush mode. You can use the hybrid, full hybrid. So every pixel is CO2 followed by 1570, or you can use the high grid in different ratio. So different ratio of ablation and non-ablation. You can use the laser-assisted drug delivery, so just the channels created by the laser and the application of different drugs or cosmeceuticals, or you can use the enhanced, so the impact, the enhanced laser-assisted drug delivery patented technology. So again, endless indications. You can customize between, you can have a balance between results, between efficacy and downtime. And again, I want to share few of our results. This is 3 sessions. Please have a look at the dramatic effect. And we talk about 2 to 3 days, maximum 4 days of recovery. You can see the setting. This patient was presented by me during the IMCAS webinar, and you can see this is 5 sessions. You can see the treatment, and after flattening of the scar around the lips, this is not my work. This is a work by an artist called Ina Bin-Nun, and she just drew its micropigmentation. She reshaped the lips so you can see the red color, but I'm sure you can appreciate the results. Another case that was presented during our previous talk, this is 4 sessions, and in these 4 sessions we injected hyperdiluted calcium hydroxylapatite. In this case it was Radius, together with the Oscar system. We use different mode or different modalities in different visits. So but again, it was in the beginning when I used the device, I was a little bit afraid. Nowadays, I have to say that I would use the so I would use the high-grade system with you can see the ratio, and I'm sure you can appreciate the result. And I will finish with this patient of this Turkish plastic surgeon. So again, that's exactly what we did so far. So the last treatment was a week ago, and she's supposed to actually come to this surgeon in next 2 weeks to go through an operation around the nose. You can have a look. This is the 5th treatment. You can see already the flattening of the scar, and I'm sure you can appreciate the result, the before. This is after 2 to 3 sessions, and this is a picture that was taken a week ago. And again, you can see the course of treatment before. You can see the flattening of the scar. I think this is quite dramatic result. And I told you, we cannot really explain why, but this combination of 1570 and CO2, in which you choose every pixel to be different, the high-grade, the innovative high-grade mode will provide you with dramatic result, and I'm sure you can all appreciate. With that, I will finish. We have some minute, I think, to answer your questions. So with that, I will finish. I'll thank you very much for the time, for the attendance. And please follow us at Instagram. You can see the address in which we post many cases of hybrid and high-grade mode, the new device. So if you have the device, please ask us what were the settings, and I will be more than happy to share the exact settings. So thank you very much. I'll stop and I'll stop the share. And Tal or Unique, have you followed the questions? Because I was concentrating on my lecture. So any specific question?
Yes, absolutely. Thank you so much, Dr. Artzi, for this fascinating overview. And thank you, all of you, for sending us these great cases. So we have a bunch of questions here. Guys, you still have an opportunity to write more questions in the chat box. So go ahead if you have any. First question from Jasmina. For you, Dr. Artzi, for ultrasound cosmeceutical application, what are preferences for formulations according to ingredients, and did you test penetration of different hormone or beta blocker applications?
Wow, that's a good question. I do not know where to begin. First, we have just published, I think it was 6 months ago, for the treatment of hemangiomas. But it wasn't with the hybrid system. This was with the Tixel. This is a thermomechanical fractional injury, followed by the application of beta blockers. But so the reason I tried the other technology was because there were publications with CO2 and erbium YAG. So I do think that if you use this device, the Alma hybrid system, followed by the application of beta blockers, I do think that it will have some role and it will provide you with efficacy, but I haven't tried it. So I cannot really give you a recipe, but I'll try it. But from the science and from what we do know, if you want, so especially if we talk about the deep and the more extensive hemangiomas in which oral beta blockers are usually prescribed, if you first do any, I would say, energy-based device drug delivery system, including the hybrid system, followed by the application of beta blockers, it will maximize your result. It will shorten the treatment time. So again, just Google my name or put in PubMed beta blockers or hemangiomas and my name, so you will see the publication and all the ideas and which formulation, propranolol or timolol. So it's valid, I think, here as well. Regarding hormones, so I haven't used it in any of my patients. I have some experience with spironolactone, and that's a topical application of spironolactone for acne, for hormonal acne. But again, this is it's not the standard. And regarding cosmeceutical and ultrasound, I usually use the 15. There is you have you can create push-pull effect with the setting are 50 on 50. And again, you can really see the material, the cosmeceutical pushed into the skin. What I use, it's again, this is the reason I told you it's a good question, but I do not know where to start. I tried and I do everything. So for example, if I have hyperpigmented scar, I drive tranexamic acid into the skin. If I have atrophic scar, I drive polylactic acid into the skin, or I use a combination of vitamin C and hyaluronic acid. What I suggest to you, because this is the field of laser-assisted drug delivery, this is a fascinating field that, again, we can only do, we can have a huge and even longer webinar on this matter. So just try. If you have certain materials which can be injected into the skin, so the materials they have to be sterile, and you have to have materials which can be injected into the skin, try them. So use first the laser-assisted drug delivery. We're talking about the hybrid, followed by the application of those materials. Using the sonophoresis, you will have better outcome. I hope I answered.
Okay, great, thank you. We also have here Yonit from my Alma's clinical team. There's a question here about the pulse duration. So Yonit, maybe you can pick up this one. The question is, what is the pulse duration in 1570 nanometer laser? And is it possible to change it in the platform?
Yes, of course. So hi, everyone. It is possible to change the pulse duration up to 12 milliseconds. So it's a wide range of pulse durations and different laser skin interactions we can get using these specific wavelengths.
But one thing you need to add, again, this is a very strong device. So I have been playing with the device for the last 2 years. And while telling you that everything is possible, I really meant that everything is possible. This is the reason that in the modes, and I'm not talking about the free hands, I'm talking about the different modes, we had our recommendations and the predetermined settings. Because if you, for example, use the 12 millisecond duration in different combination with CO2, oh my God, you will have adverse effect. It's not good. So please stick, at least in the beginning, to our predetermined settings. But with this device, and this is the reason I told you it's a very innovative device, everything is possible. You can change the power, so the energy, you can change the on time, you can change the density, you can change the ratio of ablation and non-ablation, you can change the ratio of ablation and coagulation. Because of the fact that everything is possible, you can have many more adverse effects. And we, of course, tried to safeguard yourself and your patient. And this is the reason, start with our recommendation. If you combine between CO2 and 1570, never exceed 4 milliseconds.
Thank you, Dr. Artzi. Endless capabilities, but yet safety is beyond anything else. So there's one more question here for you. How state of scar maturation influences the ratio between ablative and non-ablative? I think that what Jasmina means here is how the age or the level of maturity of the scar influences this ratio between ablative and non-ablative.
That's a good question. I'm not sure we have the answer so far for I can again estimate it. But first, I think that talking about let's start with young, immature scar. Again, it depends which scar, but I'll try to make it broad. Talking about immature scar, you have to go with very low setting. So first, and I'm talking about either non-ablative or ablative, I will go to low energies and I will go to low densities. This is one thing which is a rule. Talking about the ratio of ablation and non-ablation, again, this is the first device in the market, and I'm sure many studies will have to follow in order to say and to answer you scientifically. But I would go, so if I would have to answer your question, I will, talking about immature scar, I will go to less non-ablative and more ablative in the lowest density and in low settings. Again, I think it will provide with better aesthetic outcome. If we talk about mature scar, this is again, this is not, if I want to really answer Dika's question, I have to see the scar. So how, first, the cause of the scar, second, of course, the age of the scar, how the scar looks, if it's a widespread scar, hypertrophic scar, if it's a linear scar, how thick is the scar, which body area, and then I will probably determine on my setting based on my experience, not based on scientific work. So for example, and again, this is just, I would say, my experience. I think if you had other scar experts, maybe they would come with different answers. So talking about relatively thin hypertrophic scars in the body, I will go towards more non-ablative and less ablative, and I will go towards relatively moderate power. And I'm talking about the CO2 moderate power, so let's say 30 or 35 watts, and I would go to 0.6 or 0.8 millisecond. Again, the ratio will be I'm talking about the density, will be low. It will be approximately 3. And talking about the 1570, I will go to 10 power and 3 millisecond, and I would go to ratio of 1 to 3. So more, so 3/4 1570 and 1/4 CO2. If we talk about, let's talk about the face. So if we talk about the face and we talk about thick, very thick, let's say more than 2 millimeters, hypertrophic scars, then my setting would be totally different. I will go to more ablative. I will go to, maybe I will just use in the beginning, I just use the CO2. So I will just use fractional ablative CO2, or I will use the hybrid system in a 1-to-1 ratio. My setting will be very high, so my density will be the lowest. My settings will be very high. I will go with 55 or even 60 watts, and I'll go the shortest on time, 0.4. This is regarding the CO2, and regarding the 1570, I will go with the lowest setting. So I will go 8 watts and 2 to 3 millisecond. Again, the density, the lowest possible. So again, it's very difficult to provide recipes, to provide recommendations for setting based on a question. But if you use the device and if you send me either by a mail or via follow us in Instagram, then again, you can just send, and my team always refer me to questions by doctors from all over. So I'll try to recommend of the settings that I would have used.
Thank you for this comprehensive answer. So no further questions. Thank you so much, Dr. Artzi, for your time, and thank you all of you for joining us today. If any further questions come up after the webinar, feel free to approach us and we will address them. And if you need any further material for Alma Hybrid, please feel free to contact us, the marketing team, or your business partners, and we'll make sure to provide whatever you need. So thank you, everybody. Have a good day.
Thank you.
Bye-bye.
Bye.